So as part of our duty of care towards our patients, our staff, it's important that we test anything around emergencies so that when we hit a real emergency, we know exactly what we're doing.
Yeah, it's really important that we exercise all of our plans and arrangements. Every trust has a series of plans that deal with specific incident types. And you're never quite sure whether the plan works and whether it survives first contact with the incident type. So it's really important that you road test it as robustly as you can.
So what we've found today is we found some areas where potential perpetrators could get into the hospital, and we understand some of the ways we can prevent that. There's quite a bit of learning around how we interact with each other, whether through the use of radios or phones, and ensuring that we have clear communication around everyone in the hospital.
So Exercise Bell has taken 6 months to plan. The run through itself was fairly straightforward, getting a scenario and giving it that road test, but it was really important that we had patient safety measures, chaperones, umpires, and then delivering lockdown training on the process to every member of staff here in Bridgnorth.
Exercises like this help keep our community safe, so in peacetime it's always good to kind of exercise, learn from these kind of scenarios to help us prepare for the future.
I was really pleased to be invited today because exercises are incredibly important. It's an opportunity for us to understand our processes and plans, and for staff to actually work their way through them, and an opportunity for them to actually look at the reality, because obviously as an emergency planner we know the importance of planning, but actually when you have an exercise like this, it then becomes the importance for other people who have a role within that exercise as well, and especially those on an operational front.
So exercises are really important for learning, so it's not about everything going perfectly during an exercise. It's really about having that space for people to practice their skills, to test our plans, and to make mistakes. So it's a learning environment. We don't expect everything to go perfectly, but it brings everyone together, so not just people from the trust, people from multi-agency partners as well, and gives us that space to identify lessons and improve our plans and training.
In the event of an incident like we've exercised today, obviously it's bigger than Shropcom, it's bigger than Bridgnorth Hospital, and it involves all our partners across the system, so health partners and other agencies as well. So when we exercise, it's really important that we have that wider stakeholder engagement. Today has been an incredible example of having those stakeholders work with us. So we've had external agencies come and help us. They've also learnt a lot. We've had our League of Friends come and support us, and that's been absolutely amazing. And of course, our brilliant Shropcom staff, not just from Bridgnorth Community Hospital, but from across the organisation, have come to support as well.